Good afternoon, everyone. Welcome to the Wayside Maternal and Infant Health series. This is our second to final series in this new session. We have today mother, I call her mother, Hazel Tanner, a retired nurse from our community who has been engaged. We've been engaged in many places and community from Minneapolis Public Schools to the Healthy Black Pregnancies Board currently. We have this series here at Wayside Recovery Center, and we really thought a lot about who should we talk to, who aren't we talking to when we received the funding from Minnesota Department of Human Services and the funding from SAMHSA, which is a state opioid response grant. Wayside Recovery is a treatment center that has been around for 60 plus years, caring for women and children and families, and providing this care from a holistic approach. And so when we designed the series, we thought about how important it was to make sure that we were not reproducing what might else be happening in our community in terms of other Project Echo series. It meant partnering, inquiring and listening to other Project Echo series and partners such as the University of Minnesota and also HC Med, as well as some other supper clubs around the Minnesota and Wisconsin area, which I think that particular one is led by the University of Iowa. The reason why I say these things is because I think it's just really important for us to hear from Hazel Tanner today, her perspective and sharing with us about the role of the community health worker. I recently received my certificate as a community health worker from St. Kate's. And in our conversations in community and in our work, we're trying to think about how can we use community health workers in different ways, how valuable they are, what education do they need. And we know this particularly came down, right? This ask came down from our federal government, which is why there was HRSA funding. And so I'm just broaching this conversation and sharing a little bit about why we approached the Wayside Maternal Infant Health series, looking at from a very diverse view. It was originally intended to be created for medical doctors and health professionals. But we also knew with COVID, we had to pivot. And that meant that we needed to reach not only a broader audience, but understand the diversity of the audience that supports women in healthcare, but also that was working in this maternal and infant health space. And more importantly, the two main questions with every series we're asking is how can we reduce the disparities and how can we improve outcomes for Black and Brown moms, BIPOC moms. So that is why we have approached the series with our presenters and the diversity of their experience and professionalism that they provide in our community. And so I thank you for joining us today. And I will introduce Ms. Hazel Tanner, and she will share a little bit about herself, and we will have a presentation, and then we will have time for question and answers at the end. You are welcome to put your questions in the Q&A or the chat, and I will assist in that moderation at the end. Thank you so much and welcome.
Thank you. So you want me to start?
Yes.
I share, and I'm going to bring up the presentation. It's on community health workers. Okay, let's do this. And you have to bear with me because I'm new with this technology. Okay, let's do this. There we go.
There we go. Awesome.
Let's go back. So here we go. Community health workers. And let's just do this. Here we go. So again, my name is Hazel Tanner. I'm a retired nurse, a member of the Minnesota Black Nurses Association, and a treasurer for the Healthy Black Pregnancy Integrated Health Care for High-Risk Pregnancy, for ITRIP, that Nicole just alluded to. And my main goal, again, I'm an advocate for community health workers. So what I want to bring to you today is the importance of and the various roles of a community health worker. I also want to share one of the goals and objectives is to define a community health worker, identify the various roles of the community health worker, and identify the core values of a community health worker. Okay, community health workers are frontline public health workers who reflect the values, culture, and experiences of the community in which they work. CHWs also develop relationships of trust with their clients, which is different from the provider-patient relationship that are based on clinical experiences. The CHW could bridge the cultural and linguistic gap that commonly exists between healthcare providers and patients. They speak the same language of their clients and have similar experiences. They relate to their clients from a position of shared background and experiences, which encourages open communication about health-related issues, ultimately resulting in improved healthcare outcome. And for me, this is extremely important, the phrase improvement of healthcare outcomes. I feel that CHWs can play a pivotal role in reducing the health disparities in our community. Core values for the community health workers are three, and very ideal, not I'm going to say idealistic, but the three very important values is trust, developing trust with the relationship with the individuals one-on-one as well as in the community, respect, and respect in all capacities for everyone, and dignity for all human beings. So you're teaching with treating everyone with trust, respect, and dignity for all human beings. Community health workers, they provide a critical support and improve the health of a broad kind of population by several roles. And I'm going to run through these not really quickly, but it's all encompassing. It deals with health as well as social determinants of health. So they're educating the clients about proper use of healthcare facilities and when to seek emergency medical attention. They provide cultural and linguistic appropriate health and nutrition education. They support lifestyle changes like developing balanced diets, increasing exercise, reducing tobacco or alcohol use. They also lead clients through the health and social service systems. You know, that can be really a rat race and stress producing. And so having someone to be served as a liaison between the communities and the health agency is really a major plus in helping reduce stress. We're going to talk about that in a little bit. Improve communication between the client and provider regarding the plan of care. And that's helping to explain stuff. Again, we're not asking community health workers to be nurses or doctors, but they can put in a lay term because hopefully that education, that community health workers will be able to explain medical lease to English for their clients. They also can help clinical appointments. CHW also locates community support and resources in the client's geographical area. Advocation. The advocating for the individuals in the community is also extremely important. Advocating for the clients and sharing self-advocacy strategies. So teaching their clients how to advocate for themselves within the health and human service system. CHW also assists clients to apply for benefits such as Medicaid or Medicare to increase the rates of insurance coverage. Connecting clients to food, medicine, and other necessities. They also provide guidance and social assistance to community residents, provide referral and follow-up services, otherwise coordinating services. They proactively identify and enroll eligible individuals in federal, state, and local, private, or non-profit health and human service program. In addition, and this is the area that I mostly work with in the past, and well, not current, but in the past when I was working, when I was with the CHWs working with pregnant women, and it's shown to increase well baby checks, dental exam, and developmental screenings among children, decrease preterm delivery and NICU admissions, and improve the health of the pregnant mother and reduce health costs. As was stated earlier, I'm on the board of the Healthy Black Pregnancy, working towards reducing Black maternal and infant mortality. Our Black maternal and infant mortality rates are steadily increasing, not decreasing. Black women are 2.3 times more likely to die than white women. 80% of the deaths are preventable. Social determinants of health plays a major role in the pregnant woman as well as the general population. CHWs, I feel, can make a change for the positive in our communities. All of these activities of the CHW can be applied to the 7 functional roles of a CHW. The first of which, one of the roles, is a lay health worker. A community health worker are themselves a member of a target population and often act as a bridge between the healthcare system and the population they serve. Being a member of a care delivery team, CHW offers direct health services under the supervision of a health professional. And this is the area that I played in with the Way to Grow program and a mentorship program years ago, working with, at that time, we call them neighborhood health professionals, but well, currently they would probably still be called a community health worker. They also, CHW can work as a care coordinator. CHW works with individuals who have chronic conditions and or need help in navigating the healthcare system. CHW can work as a health educator. So they deliver health education to target population related to disease prevention, screening, healthy behaviors, and they teach educational programs in the community. CHW also can be an outreach and enrollment person. So it's similar to the health educator, but in addition, they have enrollments in addition to outreach and enrollment responsibilities. They also conduct home visits to offer various kinds of support, promote healthy behaviors, conduct home assessment, then offer advice and make referrals for enrollment in government and community programs. So this role, the community health workers or neighborhood health professionals that I worked with in the past had both this role and as the part of the care team, because they did home visits, did home assessments. So they was doing these 2 roles in one. A community health worker can also be a community organizer. His acts as a community organizer and capacity builder, promoting community action, securing support and resources from community organizations to implement new activities and work with communities to seek policy and social changes. And this last one is relatively new, is a school-based intervention, whereas a CHW can provide education on a broad range of topics with students from violence prevention, resilience development, obesity, smoking cessation, and drug and alcohol abuse. But in this role, they're inclusive with being parental involvement. Again, in the program I worked with before, the parent was involved with, especially with the teen mom, was part of the discussion when the home visitors went to visit in the home. So any family support was also always involved. So parental involvement should be across the board, but in all these roles, if you're dealing with a client one-on-one. So major strategies for reducing health disparities with CHWs. While interacting with community members in the various roles as a CHW can make inroads of the health of the client and community by discussing 5 important topics in addition to their roles in navigating the social determinants of health issues: hydration, nutrition, exercise, sleep, stress reduction. This is a whole nother workshop that I'm not going to get into, but these 5 areas are the foundation for reducing health disparities for major health concerns, such as diabetes, obesity, high blood pressure, heart and kidney disease, and mental health. So any parameter that you're working with a client, whether you're working with moms and babies, pregnant moms, or one-on-one with individuals, if you have a specific disease that you work with, say if you're on diabetes prevention, or if you're on high blood pressure prevention, you're going to cover these 5 areas of hydration, adequate drinking water, adequate nutrition, and really explaining what is nutrition, because going to the Mickey D to get a Big Mac, or French fries, and a gulp, or whatever, the big gulp thing, some people may think that's a nutrition, but we need to reschool, reteach people what is adequate nutrition and having a covered plate when they're eating. Exercise is really important, at least 150 minutes a week. So it's like 30 minutes a day for time 5 days. Doesn't have to be strenuous, but to get up and walk around. Even if you're watching television, if you commercials, you can get up and walk around during commercials. Commercials are about 5 to 6 minutes in length. So if you can get up and move, run in place, walk in place during commercials, watching television, you can get your steps in and exercise. Sleep is very important. This nation is a sleep deprived nation. So you need an average for adults need at least 7 hours of sleep. So you want to plan for that. Stress reduction is learning coping mechanism, how to reduce the stress in your life and identifying what you can handle and what you can't handle. Sometimes we stress over stuff that we don't have any way of dealing with it. Deal with the things that are important to you. So I'm getting off tangent, but I think can't stress this enough. These 5 areas are imperative for good health all the way around, whether you have chronic condition, you want to maintain your health, you want to do hydration, nutrition, exercise, sleep, stress reduction. The value of a CHW. Return on investment of a CHW. For every dollar invested in a CHW intervention, there would be a $2.47 return to the average Medicaid payer within the fiscal year. This is from an article that I read. And really the amount is from anywhere from $1.97 to $3.09 on return. So they average it out to $2.47. So the ballpark figure, for every dollar spent, you can gain $2.50 with the intervention of a CHW being present and working with communities and individuals. However, all too often, CHW face low wages and lack of career advancement opportunities. That in turn contributes to turnover, attrition, and broader workforce instability. Educating other healthcare professionals about the critical role of CHW is a step in decreasing this attrition. And this is why I signed up with Nicole to do this presentation, because I have been an advocate for CHW since the early, I think late 80s, early 90s when I was in public health nursing. I'm seeing the role and I've seen how important they made a difference in our client population that they work with. Higher wages and more training opportunities for CHW would also be very beneficial. It is important to recognize and value CHWs. These are individuals who are making considerable strides in promoting health and narrowing access and outcomes inequities. Discussion. Hope I'm not going too fast, but CHWs can serve as a bridge between the formal health system and vulnerable communities, helping their colleagues, such as nurses and doctors, better understand the patients they serve and prioritize their time addressing more complex medical problems. CHWs are central to efforts to address clinical and community integration and address the social determinants of health. It would be helpful if healthcare providers, Medicare, Medicaid, insurance carriers providers, provide funding streams for the expansion of CHWs in community organizations, clinics, social service agencies, home care services, and etc. Now I want to spend a little more time on talking about the standardized CHW training, with CHW mentors and longer internship. So I have been concerned, like I said, mentioned before, I have concerns regarding the standardized curriculum for CHWs and the length of time for digesting information, the practicum, internship, and mentoring, if they had any. Several years ago, it was about 2018, 2017, 2018, I was part of a CVAS cohort, which is Community Voice Action group, and we focused on the issue of CHWs underemployment in OBGYN clinics. And due to lack of formal training in maternal and child health, the goal was to develop recommendations for an enhanced community health worker curriculum and practicum with an expanded maternal and child health section that is culturally specific to African American health. Hopefully, the expanded knowledge and skill sets would lead to increased employment opportunities for CHWs. Our cohort developed a list of questions to do a survey with CHW students, new graduates, and some who have been working for at least a year. and exempt the questions we had. Well, because we had looked at the curriculum and we did not see much time in discussion on maternal and child health, implicit bias, and how it affects health outcome. So we asked them where they currently enrolled. Hold on a second, sorry about that. I'm having some work done on my house while I'm doing this, you guys. So pardon me. I'm having some gutters. So if you hear any knocking and noises, because of that. I can't. I'm on a Zoom. Hold on. I can't. I'm in the middle of the Zoom.
Okay. All right. We'll talk to you later.
Thank you. Sorry about that, ladies and gents. Okay, so we asked the CHW if you're currently enrolled, were there any barriers to getting into the program? How satisfied they were with the program, with the instructors? Do you feel your curriculum provided sufficient maternal and child health education? What is your level of knowledge about maternal and child health in the populations of color? Are the contents of the program meeting your expectations? And what is your definition of a community health worker? Have you been assigned a mentor? If yes, how helpful it was? As your school talked about job placement, and what more you like to say about your training or the internship? And then we had question for the post. Is that, again, we asked them definition of the community health worker, how prepared they felt, how prepared do you feel you perform the duties of the CHW? Do you feel the curriculum provided sufficient maternal and child health education? Is your level of knowledge about maternal child health in population? What is your knowledge about maternal and child health in the population of color? How prepared do you feel to provide care for women and children in order to improve maternal and child health outcomes? Did the skills you acquired during your training and internship prepare you for your role as a CHW? What school or program did you graduate? What recommendations do you have to improve the overall CHW course? And were you assigned a mentor? If yes, how helpful was your mentor? And what more you like to say about your training or internship? Many of the survey participants stated they did not feel confident to work independently after completing the CHW program. We gave our findings, and I'll read our findings to the Minnesota Community Health Alliance. And so some of the findings that we found, we have about 4 of them that we returned in to Community Health Alliance. First, there was a consensus among the respondents when asked about their level of knowledge, skills, and proficiency in maternal and child health. They all stated that the curriculum covered very little maternal and child health topics, and when it did, the contents were not specific to population of color. As a result, respondents stated that they are neither comfortable nor adequately prepared to provide care specifically targeted to improve the health outcome of women and children. Second, the majority of respondents stated that the amount of practical hands-on, quote unquote, training offered by the program was very limited. Specifically, there was insufficient training on practical skills like blood pressure and blood glucose checks, and how to conduct proper home visit, or in how to conduct screenings for specific chronic diseases. Third, the majority of the respondents stated that they were not assigned a mentor during the program, which would have helped students navigate resources, and receive support during the program. And finally, the students expressed the need to standardizing the CHW program and the CHW curriculum across all schools that offered it, as well as the need to include continuing education and training for CHWs. And this was from the students. So recently I spoke with 2 CHW who graduated within the past year from the CHW program, and I asked them the same questions. And I'm happy to report that they felt that they were prepared to work at CHW and would like to take more classes or training for specific areas. The curriculum included basic information on maternal and child health. They also recommended the following: more diversity in the curriculum and community expert speakers, a session that discusses the real application to community health work in the community, identify all the options and occupations for a CHW, and they look forward to more improvements for all CHWs and funding to obtain more CEUs based on the content or role in the community placement. Neither of these CHWs were assigned a mentor while in the program. Both had resources, however. They had already made network connections with others in the community already, so they had a resource for themselves, but the school did not provide a resource for them. So the recommendations, I'm flipping back to the survey that we did originally. So kind of included what they did, an improvement, but I was glad to hear that it was done. So we have recommended to ensure future CHWs are better prepared to cater to the needs of women and children. We want to make sure that CHWs can provide holistic care in a more culturally sensitive manner. Ensure CHW gain more hands-on training and experience geared towards improving maternal and child health outcomes, and it seems like that happened. Integrate culturally proficiency classes to address and recognize implicit bias. Include more supervised practical hands-on training into the CHW curriculum, and to provide each CHW student with a skilled mentor at the beginning of the program. So recommendation in the program, going back when I was doing the Teen Moms program and the Way to Grow program, where I trained the home visit, where I trained the home visitors. We had written tests on each topic to evaluate knowledge retention. We reviewed topics that were a little more challenging. We had individual self-assessment. We did classes on recognizing biases and stereotypes. He learned to be an active listener. Development of observational skills of home environment, as well as nonverbal communication. We did various role plays. We learned various coping skills for themselves as well as their clients. We did one-on-one supervision as well as group supervision. The young women who work with the neighborhood health professional, or today we call community health worker, and they completed the program assessment, had the following results. We had 4.3% received late or no prenatal care, and that's because they entered our program late in the pregnancy. But those who had started earlier, 95% of the infants weighed 25 grams or 5.5 pounds or more. 87% of the women attended 9 or more of their prenatal visits. 70% of the program's participants had completed high school, attended high school, or worked on the GED, or attended junior college. And when I received that program, it was only like 36% completed college, finished high school. I feel that the education of a CHW equals education of the community. What doesn't work is not having a PHN or other healthcare providers or working along with the CHW. I may get some pushback here, but I still feel that the CHW does need to have a connection with a healthcare provider while working with the community, because you're going to have people with comorbidities that they need to bounce off some health information. Again, we're not expecting CHWs to be nurses out there in the field, but they have basic knowledge. But if there's some complications that occur, or there's some questions that arise, the CHW should have on speed dial a healthcare provider, a public health nurse that she can work with in addressing issues at the time. Despite of all the benefits of employing a CHW, there's limited recognition of their role and value, not only to the healthcare system, but society as a whole. The demands for CHW is projected to grow, and we need well-prepared CHWs to fill these positions. I feel CHWs are one of the essential links in decreasing health disparities and improving the health of our communities. Now, I have been speaking, and now it's your turn. Does your place of employment utilize CHWs? If so, in what capacity? If not, why not? I'm just going to show you my resource, and then I'm going to shut down this presentation, the slides, and stopping the share. Okay, Nicole, are there any questions?
All right. I don't see any questions in the Q&A. I'm going to check the chat. Are there any questions, comments, reflections? And I can allow you to speak because we have a small group. So I am going to allow those of you, I'm just going through the list here.
I know I went through it fast, but I'm an advocate for CHWs, and I like to see this role be increased and be utilized. So please, everybody, don't just hold on, ask a question.
So one thing I would just like to start us off with is I have been recently trained in some of the things that Ms. Hazel Tanner is sharing. I agree. It would be really great to have like a community nurse that if I'm working with a particular family, we're not clinical and we're reminded of that all the time. We're not clinicians, similar to, I always let people know I'm not a social worker. And so I think it is helpful even when we're given plans for patients or clients. Yes, we're able to help them with resources, we're able to help them complete forms, but yet there may be some questions that the client or the patient might have that I really do need the advice as a clinician. And so that was one important point that you shared in the presentation that I agree with. And I would love to see there would be some kind of care coordination or cadre that would be a support to community health workers in our respective areas.
Do any of you work with community health workers? Can you unmute?
Yeah, they should be able to unmute if you like. Any comments? I know some of you signed up for today. What was share the interest of why you wanted to be a part of this conversation regarding the community health worker also.
Right. Did any of you guys learn anything new about community health workers from the presentation? Did I speak too fast?
I know some of our groups are quiet and also some of them are often multitasking. But we'd love if we could have some feedback from you in the audience, because this was more of a presentation to be a part of a discussion, to also hear from you, to hear your thoughts. Do you work with them? Do you need them in your clinic, in your center? Would it be helpful to have them in a school? What is your interaction with community health workers? And having learned a little more maybe today, where might we have a community health worker? For instance, at Wayside Recovery Center, we know that the majority of work with maybe our inpatient families, but our outpatient families who are in our supportive housing could use a community health worker. There could be a role for a community health worker that is helping to support family, identify the resources that they might need in community, right? That would reduce stress around uh, which can also, we know, be a trigger in terms of relapse or different things like that. But a community health worker can definitely help to fill that gap. So I see Rachel has a comment here. She says, our agency is just starting to integrate CHWs and MCH work. We have 2 folks starting soon and will be working towards certification.
So Rachel, you be working with the 2 new CHWs? And what is your role at the agency at MCH?
Yeah, I'm with Northeast Minnesota, and so I help support home visiting across 4 counties. And we're just getting started with community health workers, and they'll be working towards certification. And so we'll still work on the infrastructure and support around that. And so as a program manager, I won't work directly with them, but they'll be part of our team. So I will, but they'll work more closely with the nurses that are doing the home visits. Good. And helping to support kind of parts of the referral process and follow-up and other pieces. So far, we're just getting started though.
Okay. So the home visit, I mean, the community health worker would be doing home visits with the nurse?
They'll do some alongside, and then they'll do some of the case management pieces, and then a different count. So that's in one county, and then another county, it sounds like their role will be much more broad and support across a few different units. So I'm not as clear about what that one will look like yet.
Okay, so you're having one-on-one. I guess when I worked with the community health workers, like I said, we call them neighborhood health professionals back then, with the teen moms, I did joint home visits with them on like the initial assessment, looking at the home environment and kind of teaching some of the things that you can't be taught in the classroom, what to look for, what not, what to see, what you don't see, hear what you don't hear in the individual. So when they're making their own home visits with the individual, they can be my eyes in the home, because the nurse can't see all the patients, but at least they can bring back information and they can have that discussion with the client about the client. So I thought that was very helpful. They brought a lot of good information. Like I said, we got a lot of good results using the home visitors in the home and much improved outcomes. Thank you for sharing, Rachel. Anybody else have interaction with community health workers? Hello? Anybody there? Anybody learn anything new about a community health worker? Or did you not hear, with this expectation, hearing something different? So I like an evaluation or a presentation, guys, really. Tell me what you learned, what you did, was there anything I missed? So maybe we can have a discussion. If you have any questions, this is what the time, I left time in the end so we can have discussion. You had an interest in the topic?
I think one of the other comments that I'd like to make is that how important it is for those of us who are in the field where community health workers could be used or utilized more is how important it is for us to share that information with our workplace and with community as well to make sure that we're able to utilize the new skills of them. Brooke, I see it says, I just heard about what CHW is a few months ago. So this was a great intro for me on how CHWs can be involved in health equity. And then Chanel said, I don't work directly with CHWs in either of my roles, but we may have them at some of our Fairview clinics. I don't know how much, excuse me, how much about the role until today. So thank you very much for sharing this information. So one thing that I want to just comment, Chanel, where you're saying like you're not sure about how directly some of the names people have different roles in hospitals and clinics, but really in the background they're CHWs. But it might say care coordinator, care assistant, or something like that. But yet they are actually CHWs in the background in terms of human resources. And some organizations are using the title outward facing now because more people are familiar with it.
There are many roles. That's why I was identifying those 7 roles. And it may not be called a community health worker. A lot of times just called patient advocate, but their role of the community health worker. So I just want to make, that's why I'm making this presentation, because I feel that they're really a good link into helping to decrease the health disparities, because they can voice some of the questions that the clients can voice or don't know the questions to ask when going to healthcare providers, or trying to get the social determinant of health, in line. So like food, shelter, transportation. So all of those things are key in the health of the community. And stress reduction is apparently is really way up there. That's what's a lot of the times with pregnant moms, and that my focus is on the pregnant moms because Black moms are dying much after too much, and Black women and Native American are dying at too much a greater rate, and it has to deal more with stress and carrying the baby. And so helping the mom to reduce the stress and get the basic priorities of Maslow hierarchy, that bottom line clear so they can move up the hierarchy is really essential, and community health workers plays a pivotal role in that.
Definitely. And again, I can't say enough about the advocacy of the role and how important it is to start to ask questions like, do we have them? And sometimes we do want community health workers to be paid well. So I don't want it to be looked at something where it's like, oh, well, we can get a community health worker instead. You know, we're only as strong and as knowledgeable as the training that we receive. And if it is an opportunity, yes, for a community health worker to come in, but if they have the expertise or the interest to be a nurse, we also want to get behind that, right? As organizations and offer additional training or additional certifications based on their respective roles.
The community health workers being, like I said, that's why I'm doing this presentation, because they need to be known that they're a vital link in the health of the community. I mean, we learned this in the pandemic. People don't look at the garbage man as a key, but when the pandemic and they weren't out there to pick up the trash, you saw how important it was. So everybody is important in the role of health of the community. So you don't want to discount any role. But community health workers working in it with their clients, participants, for me, is a key. And our health disparities for African American, Native American is getting worse, not better. And so we need to have people help them navigating through the healthcare system. And talking about implicit bias. Implicit bias plays a major role in how we being treated and how we are seen when we go to healthcare providers. Any other comments? If you don't have them in your clinics, please talk them up. Give them that. We need community health workers in all areas.
Okay.
Other comments?
If there are no other comments, please know that I am a CHW working at Wayside Recovery, and I'm working in maternal health. And I saw that it was important for me to get that certificate where I didn't have a degree in health. I have degrees in other things. Think of Mother Hazel Tanner, who is in community as a retired nurse. She let you know who she's connected with in community, the work that she is still doing. I know I'm on the maternal health task force, and we're connected in a lot of ways. So even if you don't have a question today or a question bubbles up for you, you'd like to reconnect with um, Mother Hazel Tanner, please reach out to me or reach out to her. We're interested in seeing where this career and this pathway can go to help reduce disparities, improve outcomes, as well as intersect in health equity for all, really. Community health worker isn't just for the BIPOC community. Community workers are working in all places. They're working in school clinics, etc. So please know that that is happening.
Yeah, I mean, like with community health workers, not just African American, Native American, because even when I was working back with the dementia program, we had Native as well as Southeast Asian, as well as African American and Caucasian community health workers. So when I speak community, I'm talking about all of our communities, because we all need the help and advocacy and navigating through the system for reducing social determinant of health when it's really stressful, and trying to find a way out of no way. A community health worker can be that person to help you to navigate and be the point person. So my experience for the public as a public health nurse, I have the envision of the client is like the spoke of a bicycle. I'm thinking Nicole probably heard this because I've said it so many times. But the spoke of a bicycle, you have all of those spokes. The center would be the client. So anywhere on the spoke that the a client touch a base for needing resources, whether it's transportation or a food shelf, I think the person at that point should be able to connect them to the next resource that an individual needs. So if everybody is mindful that the client is the center, help them when you see them in time, and not just give a telephone number and say, call this. No, make it a warm handoff to help that individual, because at that point, they're most likely stressed out. And so to help to reduce the stress on an individual, reach out and support. So that's the whole main part of that I want to get across. So CHWs, and then wherever on the resources circle, they should be able to do the next handoff to help an individual.
Thank you. Well, thank you everyone for attending. Thank you, Mother Hazel Tanner. I am very interested in where this career pathway will go and how it's being implemented. We know that the federal government has seen this as a viable resources for our healthcare crisis across the country. I do appreciate our government when they recognize there is a solution that can be used, but it's really going to take us on the ground to let people know how valuable it is and how to expand its network, how to talk about the skills and resources that we need to attach around it, and that overall investment. And so, this is an area, again, I know that wayside recovery. I am one of the community health workers. I don't know what other staff may have taken on this opportunity. And I just want to encourage each of you, however you're connected in community, that HRSA still has free money out in community. St. Kate's, I believe, still has money. Hennepin, North Hennepin Community College, I believe, has money. It is online. It is a great starting place. And I just encourage you to continue to spread the word, not only to community, but to your organization. And as Mother Hazel said, it is very important for us to understand that health equity, it means that we want everyone to receive the appropriate health care and resources that they need, whatever intersection that they come from and whatever community they represent. We don't want to leave anyone behind. So
Right.
thank you so much, Mother Hazel. And for those of you who attended, I will be working on uploading our videos as well as sending out certificates if you are interested in a certificate, CEU. So thank you, everyone. And I hope that you will attend. We have one more session next week in our series. And if you have any additional information or would like to if you would like to share with me a name of a great speaker or topic that you think is really critical to our community, please do not hesitate to email me. And thank you, everyone. Have a great afternoon.
Rachel, Melissa, and Chanel for attending, and please share the information. Thank you. Stay safe.
Bye.
Bye-bye.